Neglect is difficult to accurately describe because there are many different theories by many different theorists. Child neglect in a legal or social term can in no way give an accurate picture of the neglected child. These children must be seen to fully appreciate the hopelessness of their situation. For years, social workers and legal professionals have debated the definition of neglect and the problems facing it. Causes and symptoms of neglect. Children who have been neglected demonstrate numerous symptoms and effects. Some physical features are not obvious, but others are painfully noticeable. In infancy and early childhood, you can have non-organic failure to thrive syndrome, and it's a condition found in infants and diagnosed by several different factors. The first is that the infant must have fallen below the 5th percentile in height and weight. The second is that the infant must have had to have been in the normal percentile for height and weight before. And the third is that the infant has to demonstrate a delay in psychomotor development. Failure to thrive can also be an organic situation resulting from a variety of medical conditions, so you have to have a medical professional to track the infant's growth over time. Infants with this condition who are removed from the neglectful home can gain up to a pound a week when they're fed properly. Children from 18 months to 16 years old may suffer from a related syndrome known as psychosocial dwarfism, which is also known as deprivation dwarfism and abuse dwarfism. The symptoms are similar to non-organic failure to thrive syndrome because of the emotional deprivation provokes abnormally low growth and weight. Children who have psychosocial dwarfism are also below the 5th percentile in weight and height. They exhibit retarded skeletal malnourishment and have many behavioral problems. They may have bizarre eating habits such as overeating, stealing food, indiscriminate eating. They might not be able to sleep, have night wandering, are hyperactive, or have extreme children of all ages. Poor motor skills and language development delays appear in neglected children. Continued lack of attention to diet as well as emotional needs create children who have poor skin clarity and dull hair. Children who are severely malnourished develop distended stomachs and emasculated limbs. These are commonly found in countries who have experienced famine. Lice and general bad hygiene can also be signs of neglect. These signs of neglect would normally be detected by the child's doctor, but neglectful parents often leave health concerns unattended. Because health concerns are often left unattended, it is harder to determine if neglect is happening. Lead and anemia tests are often never completed, and behavioral problems are often associated with neglected children. According to Cantwell, neglected children do not do well in school because their home environment has robbed them from the ability to understand the instructions given in the classroom. Impaired socialization is common in neglected children as well as poor language development. This often leads to poor communication with others. As neglected children get older, they often feel isolated from everyone who is not at the same developmental level as they are. Children do not develop an internal set of standards or morals to guide them. Instead, they respond to external stimuli. Children who are like this, whether stealing is wrong or not is not important. What's more important is getting caught. Along with this type of impaired thinking comes the need to have things immediately, because they are never sure if a reward or opportunity will be available later. In adolescence, it's common in neglectful homes for older children to become emancipated, run away, or get pregnant. Neglected children have unmet needs and are isolated from people who have learned the ability to compete in society. They seek others who have the same background, and this often starts the cycle of neglect again with their own children. Intervention with neglectful families present a large amount of different problems. First, neglectful families are numerous. An average social worker's caseload has a large number of neglectful cases. Second, many workers find these cases elusive. They don't know what to expect from the parents, and neglect is often difficult to document. Often, neglect can be related to material deprivation. If a family appears to be affluent, it is easier to ignore the emotional and physical neglect of children. Third, coordination of these cases is difficult, and the organizations that social workers feel is needed is not present, and there is little ability to carry out the plans needed for them. Neglect is also difficult to document because neglectful parents do not feel the need to attend regular doctor visits or keep up with the needs of their children, making documentation difficult over a long period of time.